Welcome everybody to our Innovator Showcase, our last Tech Tuesday of 2021. Today we have Aldo Maspons and Jose Alamo from VeMiDoc with us. Jose and Aldo are innovators that have been with the MCA for several years now. And we are glad to share with all of you about their progress, their great company that they've been building, and showcase the work that you guys have done. So first of all, Jose Alamo, would you like to introduce yourself?
Sure. My name is Jose Alamo. A lot of people in El Paso know me as Joey Alamo, because there's out there that know me from the past. I grew up in El Paso, went to St. Pius and Cathedral, and you know, I love my hometown, and love being part of the city's growth. Yeah, I'm a dentist. I practice in Kyle, Texas, and just really excited about the future of VeMiDoc, which I'm really excited to talk about here moving forward.
Great. Aldo?
Yeah, so thanks for inviting us here to talk about ourselves. So my name is Dr. Aldo Maspons. I'm a pediatric gastroenterologist. I'm born and raised in El Paso, Texas. So I'm CEO and co-founder of VeMiDoc. And we first got introduced to the MCA as they started their push into the entrepreneurial world and startups, and so we met with at the time it was Jeff and Emma were the ones that kind of shepherded us through the process. And I see Ernesto's here, and he's one of our cohort members, one of the first ones. So here we are, and you know, Albert, I know we're kind of doing an interview thing, so you know, let's take it from here, and then let's see where we go.
Sure. So don't feel pressured on your time, but I would first like to start in what is VeMiDoc? What's your story? If you could share with us as much detail as possible.
Yeah. So we're a mobile health platform, and our goal is to improve the medical outcomes for patients. So we help physicians improve the medical outcomes of their patients. Our focus is to the Latino community. So we started off here in El Paso with a goal of ours to grow into throughout Texas and the rest of the United States that has Latino presence in terms of patient care. So what we do now is the way we help physicians improve outcomes is we help decrease their cognitive load is one of our steps. So when you have patients with chronic disease, really difficult patients to manage, complex patients, it's tough to see, especially here, everybody can appreciate if you've been to a doctor's office, there's really long waiting times. And physicians here are really busy, mostly because we're really underserved and there's just a lot of need. And you see the patients that's right in front of you, and there's just a lot of patients, the thousands of patients kind of that left your office a week ago or a month ago or 6 months ago, and we need some follow-up for them. And so that's where we come in to kind of help decrease their cognitive load and help manage those patients, not necessarily for them, but to help keep tabs on those patients. So we're launching a lot of different projects in different disease states, and mostly in the chronic care space, and then and some in the primary care space. One program in particular that we're launching was with Dr. Hernandez, who's best nephrologist in town for sure, and actually probably one of the best physicians in El Paso. And we're helping him manage patients with polycystic kidney disease and lupus nephritis, two diseases of which require a lot of intricate care, and they have high morbidity and mortality, especially for lupus nephritis at least. And so we're kind of helping. We're going to launch that program soon, and hopefully help decrease his cognitive load. That way, his patients can feel checked in on a regular basis, and then get ahead. So we play offense. So disease doesn't know a holiday, disease doesn't take time off. But if you have your doctor regularly check on you, the chances of you having a better outcome are going to be better versus if your doctor doesn't check in on you. And that's kind of where we come in.
Aldo in the past has mentioned a couple of examples where, you know, it really helps explain what we're doing in a very efficient way. And not that he wasn't already, but there's the in-between time that the patients are at the doctor's office, what happens to them from that first appointment to their next appointment, and this allows the doctor to keep tabs on them. He's also mentioned about the, you know, the help about being in a hospital is that the patients are, you know, their labs are being seen every day. They're constantly being in contact. But if you're not in the hospital, sometimes the doctor doesn't have that same relationship. And so this is where VeMiDoc is kind of plugging in and trying to be that middle part, you know, just a small part of the solution of a problem that's getting bigger. There's more babies being born, people are living longer, and we don't exactly have more physicians out there. And so there has to be a better way for us to start to rethink about how we're going to treat patients. And when you consider underserved areas that are highly Latino heavy, being from the Latino community, you know, certain parts of El Paso, we knew the need, and we saw that need growing up. We felt that we really need to have an impact and provide something, a solution.
Hey, it's great that there's a couple of questions that I would like to follow up, like the Latino focus and all that, but I would like to circle to that later on. Right now, I would be interested in, you've been working on VeMiDoc for several years now. Now, telemedicine has had a huge boom with COVID, but you were working on it before that. So could you tell us about a bit about where the idea came from? Was it a personal problem that you encounter, or how did you identify the market need, but also like the decision making of actually launching something, of actually deciding on building and doing something? That's like the origin story, you could say.
Yeah.
How was that?
Yeah, so telemedicine's been around for a long time, 30 years probably, and it used to be like a camera and a VHS card and an old TV, and they used to do things like that. So I kind of already in training. So I went to med school in Dallas and UT Southwestern. I did residency in UNM and Albuquerque, and then I did fellowship at Baylor in Houston. And it's always been a little bit a part of seeing patients, but the real need was just seeing barriers to care. So we have patients, especially when I was coming into El Paso for the first time, moving back home. I had to figure out a way to take care of a lot of patients as a pediatric gastroenterologist who figuring out ways to scale myself, and then also take care of patients who don't necessarily live close to where the office is. So, you know, I get patients from Alpine, Texas, and Roswell, New Mexico, and Albuquerque, you know, all over Chihuahua even. And so what could I do to kind of see all of those patients and still give them the same amount of care and attention without having them drive for 3 hours, just so I can touch their belly and, you know, say everything's fine. And so telemedicine, I think, was we had seen it years before, I think, obviously before COVID, as that just ways for delivering healthcare in a different way, but still delivering healthcare. And so that was the goal. So we saw that the need was, at least the pain point was for patients getting in to see their physicians and when they had barriers to care. And then the pain for doctors was being able to see improve their no-show rates, because you can schedule 20, 30 patients, 40 patients in a day, but that doesn't necessarily mean that everyone's going to show up. And so this was a way for us to fill in the scheduling for doctors. That way they don't lose income and just kind of keep the pipeline filled for patients. And then COVID happened, and then all of a sudden, at least before COVID, we had one of the struggles we had when talking to doctors was, what's telemedicine? was trying to convince them of this new technology and how it's going to be awesome and all this stuff. And then all of a sudden, COVID happened, and everybody knew exactly what telemedicine is. Now you can't go anywhere without everyone knowing what telemedicine is. So yeah, it was nice at least to be a part of the wave.
Yeah, and part of the challenge now is a lot of providers have their idea of what telemedicine is, and so as we bring in a solution, if we're not clear about what we're offering, telemedicine can be something different for a lot of different people. And this is a great opportunity for us to start to talk about what we do now, because telemedicine was something that we used to do, and now we're in the patient management space. Aldo can talk more about this as he's using it in his office quite a bit, but we've transitioned into patient management, and having telemedicine as a feature of what we do, but not the primary thing that we do anymore.
Yeah, I think what helped us a lot when going through the MCA program was just really trying to lay out the roadmap, the technological roadmap for us, and what we were trying to achieve. And improving patient outcomes has always been our goal. And so when looking at the roadmap, we had to look at a few things. Is number one, is it good for the business? Does it make business sense? And then does it fit our mission of what we're trying to accomplish, which is improving medical outcomes? And so what we did was when the telemedicine revolution happened with COVID, we quickened up our roadmap and started accomplishing those features a lot faster.
Great. So you mentioned the Latino focus and all that. It's great. Like you mentioned, the improving patient outcomes. So could you give a concise definition of what your business philosophy is? I mean, values kind of get shared between businesses, but specifically for you, what is it that you aim for, but how does that translate into how you treat your customers, features of your product, how your values actually translate into your business? I would be interested if you could explain a bit more.
Yeah, I mean, that's the value, our value, what we're doing is we're improving those medical outcomes for the Latino community. We're helping physicians improve the medical outcomes for their Latino community patients. It doesn't necessarily make sense, that kind of population, because here in El Paso, most everybody is Latino. But what happens is that outside of El Paso, in the rest of Texas and California and every other state in the United States, the majority of patients are on Medicaid, and that's really our focus, is focusing on patients with Medicaid. The majority of patients who are on Medicaid in those states are Latino, but the physicians and the healthcare workforce doesn't necessarily reflect what their patient population is like. And the reason why those things become important is because you end up having a better experience as a patient when there's a cultural fit, or a connection with your provider. And that's kind of where we kind of come in as a platform. So decreasing the cognitive load for physicians and staying connected with patients in a way that's sensitive to both sides. And I think that these, in terms of Medicaid and Medicare, the reason why Medicaid becomes really important, especially we saw a really big uptick in Medicaid since COVID. So more and more people enrolling in Medicaid. And Medicaid is a state-sponsored program. Just kind of giving you some background on what Medicaid is, because not everybody's familiar with it. So Medicaid is a state-sponsored program, and every year, the goal for the state, Medicaid, they're given a budget, so they have to work within that budget to improve. They only have that amount of money for the year, and so if you have a certain number of patients that are on that program and they end up being really costly, right? Showing up to the hospital a lot of times, going to the ER, being hospitalized for long periods of time. It becomes a losing scenario for everybody involved. For the patient, they're stuck in the hospital or they go to the ER. I mean, nobody wants to go to the ER if they don't have to. Nobody wants to be hospitalized if they don't have to. You lose on quality of life, you lose on your job, on personal relationships, etc. For a physician, I think kind of makes the physician look bad if your patients are always going to the ER or your patients are always being hospitalized. And then for Medicaid, they end up losing money because they're spending a lot of money on places where they don't necessarily have to. And so if there's a large group of patients that aren't necessarily being addressed, Latino population, then what's being done? It's kind of hard to produce new physicians. If we look at the physician population of those states that I mentioned, California, et cetera, the physician workforce is not Latino. It's like really small. In fact, there's less Latinos applying, or less like diversity in the physician workforce applying than there was 20, 30 years ago. So it's going to become a problem, I think, as patients age and the physician workforce starts dying out or retiring. Then who's going to help take care of all this large group of patients? And that's another place kind of where we kind of fit in.
Great. Jose, do you have anything to add there?
No, I think the cultural aspect is really important, and that last point that Aldo mentioned is really important. Where we want to have, and this is not what VeMiDoc does, but definitely have more Latinos in the healthcare field for those cultural reasons. If we want a healthier population, it has to be. But we've seen the numbers, and we I think like Alabama didn't have any Latinos graduating from med school a few years in a row. And so as it pertains to VeMiDoc, it was really important for us to have, as part of a cultural balance, the bilingual aspect of our platform. And so if patients are seeing their patients in Spanish primarily, the patient should be seeing everything on their side in Spanish in the best way that they can communicate with their patients. I have patients I'm a dentist, as I mentioned. I have patients that come and drive to see me only because I speak Spanish. I could be the most horrible dentist in the world, but they feel that if they can explain their problem to me, they feel better about it. And so that they want to consume, the patients want to consume their healthcare this way. And I think we have an opportunity to be able to do that. Yeah.
Great. Now, with that explanation, that sounds like a great focus, and especially considering the specific needs of the user, of your customers, and such. That's great. Now, how big is your team? How many people do you have on board?
We have our co-founders are all here. So JP Garcia is here. He's our CTO. We have Jose Alamo. He's our CFO. And myself. And then we have so we have a tech team of 3. That's including our CTO. And then we have a salesperson, or success champion. And the goal of success champion is to make sure that when there's a physician that wants to implement us, that it goes well and succeeds, right? So that's our team.
Okay. Yeah. So one of the questions, my follow-up question is, we are just now recently finished Nurse Innovator Accelerator, which is kind of a boot camp of 0 to hero nurses that have their ideas and develop products and business models from that. One of the key issues is, well, healthcare professionals don't have the tech background to actually build the products, right? So how was that initial first step like? Okay, we need to build a prototype, or did one of your co-founders knew how to do that, or like building the team? How were the key hires, and what was the sequence that you had to build to grow, basically?
Yeah, I mean, it started off with Joey and myself kind of just talking, learning that we wanted to be in the space, and then kind of looking at problems and how we can go the problem solving way. And then through social capital, I think we were lucky enough to be in direct line of communication with JP Garcia. He was a so I went to college in the Bay Area at Santa Clara, and one of my best friends, JP, was his mentor, and so he put us in contact, and because JP's a tech guy, so he went through the ranks, Stanford, for undergrad engineering, and then he was at Apple, and then he had a background in entrepreneurship, and then when he heard our story, what we're trying to do and why we're trying to do it, that's when he jumped on. And I think the team is an awesome team. I mean, I think everybody has domain expertise, especially JP in the tech space. And so I think without JP, we wouldn't. I mean, it would have been really tough, a tough go at developing the product for sure.
Mhm.
Yeah, and I'll add to that is, outside of the idea and the desire to want to build something that's going to deliver better healthcare, we just had the same outlook about wanting to uplift Latinos. Whether it be in medicine, as we talked about earlier, we need more Latinos in the medical field, but as it pertains to engineering or just in different professional aspects. And so we talked a lot about this. So there was this bond on outlook and what the future could be for Latinos. And so, we want to believe that this is our first go at how we're going to have an impact in this space. But we look forward to having other influences, being helping other entrepreneurs to get from point A to point B, finding those engineers they need, finding those the funding they need, and these are large goals that we have, but we were very much like-minded in this manner, and that connected us as well. And I don't know if JP is able to say hello. It'd be really great for him to say hi if he's somewhere that he can. Hey.
Hey, what's up, guys? Hey, sorry, just been super busy we're working on some features and I have you on a separate screen, but I just wanted to say hello. It's really great. Look at this. It's kind of a funky. No, that's weird.
He's a saint. He has that halo.
No, to answer your question, Albert, I think that it's really you were talking about the nurse boot camp. I think it's really important to try to find people that sort of complement their team. The nurses don't have some of that tech background, but it's also really important to find good partners that can help you or can help them sort of separate the wheat from the chaff. Because it can be challenging sometimes to figure out like what's legitimately like good technical skills that are going to move you forward. And people can spend a lot of money and technology, and as you know, like technology is constantly evolving, right? And so it really is sort of like you got to keep on top of that, and some of that does take capital to keep moving forward. But
I think we also all get along very well.
If any of those folks like ever need any ideas or resources or things that we can help with, we'll be glad to do that. Okay, I mean, I think that if anything you take away from this is that I want you to know that the VeMiDoc is sort of a team that is very dedicated to the community of El Paso, of Texas, of Latinos, and to the extent that we can help sort of shed some light, illuminate some of the technology stuff, we'd be glad to do that. Absolutely.
Okay, that's awesome. That great to have this event and connect this way. So thank you so much for the support, for offering that insight. Now, again, a little bit going back, because I'm really interested on the telemedicine part of it. Right now, it's as Aldo said, as you said, everyone knows what telemedicine is, but actually on the sales process, on actually going and explaining your product, what has your customer, which assuming a bit about your business model, your actual customer is the doctor. You don't sell anything to the patient, right?
Yeah, that's right. Yeah, we
Okay.
actually went through the insurance company to do the selling for us. So it's tough. It's tough to do one-on-one sales. It takes a long time to go on one-on-one sales, and so going kind of backdoor, I guess, way is selling to a parent organization where they can help disseminate. It makes it a lot more scalable. The doctors are really busy. Doctors are set in a lot of them are set in their ways, and like anything, like not everybody wants new technology. And then especially when you're in a field that, like healthcare field, right? Nurses know all this, is like everyone has a workflow, everyone's got a process for everything. And then and every group is different, right? So if you're at Providence or UMC or Las Palmas or a clinic or, whatever, they all have their own culture of doing things. In the end, it's kind of all the same. You're seeing patients, you're trying to get them healthy, but the way to get there differs. And so that's in the health space. I think that's why health tech has just been so difficult to break into, right? Because it's not for everybody. Not everybody knows the lingo, the culture. And then if you're just trying to come in, like, cause you got a cool idea, it's not going to happen. It's just really rough. And so that's kind of that was our sales process.
Okay. Yeah. Makes a lot of sense that doctors are a very tight market, and you would use somebody that already has a foot in the door to go sell it, which is I've seen it as an innovative way of selling. That's a great business model. Now, that again, so
that didn't mean sorry that we didn't have to put in the work up front either. Like when we were still doing that, but it just made it a lot easier of a process.
Okay. Yeah. And how has your growth trajectory been over the past years? Like, also specifically, what has been the key steps that you've taken that has gotten you to the next levels, like those strategic points that have increased your growth curve?
The features. So I think with the telemedicine thing, it was really important that I think that we I think it made us into a technologically known company, because we kind of saw around the corner before it happened. And so I think people were like, oh, these guys know the trends, at least in health tech. And then what really is pushing us forward is this next kind of patient management, disease management tool or features. Because as a standalone for telemedicine, we had to, we're going to have to compete against these really big. I mean, we're on Zoom. How do you compete against Zoom, and how do you compete against these other things? And what we do is rely on our strengths, and our strengths are we know medicine. Zoom's not gonna. It's gonna be really tough, I think, for Zoom to come in and talk to another physician about a disease, but we can do that, or talk to a physician about the complexities of managing a group of 1,000 patients with a certain type of disease. We could do that.
And to Aldo's point, something you can't do with video conferencing, which is what most are imagining what telemedicine is. You need the forms, you need the other ways to communicate outside of just the video conferencing, which is telemedicine, and that's why we expand the features. Aldo said, and we're doing patient management now. The other thing that's helped us, project is our partnerships. Aldo mentioned earlier that our partnership with El Paso Health put us in front of a lot of physicians, and he's building other partnerships with hospitals that are also going to increase our user base, and these, which ultimately comes back to the feature list. But we're also increasing our user base as well.
How big is your user base right now? And how many states are you covering? Or like, could you give us like an indication of how?
Right now, I think from our operations side, we're still local, and we have to. So the whole like scaling part is going to be the next big challenge, right? So right now, from interactions, I think we've had over 40,000 or 50,000 interactions with the app, and then from that, then we just got to keep looking at the trends and then trying to grow. But it's still looking at the usage, and then ironing out the best path for scalability is the stage we're at right now.
Mm-hmm. So are you focusing on like a product development process where like an agile process where you're updating and constantly making better features, or is that or focusing on what you already have, the product that you already have scaling up? That's
no, good. So we spent this time improving the feature list, and then working out the bugs. And so the newest version is 2.4. So that's 2.3 is out right now, and then 2.4 will be out. We're looking for January as a release. And then right now it becomes, so this is a startup, right? So there's a lot of moving parts always. There's the technology side, there's the business side, and then there's the funding side too. So we had to spend a lot of time on the funding side, and then as people in the cohort will know already or will learn, is that like you're selling or you're fundraising, and it's tough to do both at the same time, because it's so time intensive. And so like we spent most of 2021 fundraising, and then so now we're making our next push into the product disbursement, I guess.
Yeah, and as part of the product development, we'll be looking at UX UI design, and that's kind of like putting the icing on the cake. Is how to make it look as beautiful as it can be. It's great now, but that'll be kind of the next hurdle for us.
Yeah, makes sense, because you shouldn't like put the icing if the cake isn't there, right? First, make sure that the features and everything works well first, and that's great. So you've kind of mentioned roughly what your next steps are, but like what are your main goals for 2022 or the next 3 to 5 years?
I think right now it's highlighting a lot of wins that we have for physicians around the city. Good, cool, as they say, is hot topics, cool solutions. So like, it's how can we stamp out disease and get these good stories and then highlight them, so that way other physicians can see how we're helping other physicians win, or some hospital systems can see how we're helping other hospital systems win. So right now we have a good relationship with El Paso Children's and El Paso Health. So it's making them succeed, helping them succeed, using us, and then highlighting those cool solutions, and then continue that storyline, and then using that to kind of push us beyond the city. It's tough, I think, with when you have growth and trying to get some fundraising, and then still trying to push sales, and then the next big hurdle would be outside of El Paso. How do we handle that kind of growth? What's the workforce going to look like? Is it a remote workforce? Is it a in-person workforce? So those are all kind of things that we're in the planning stages for, and kind of see how it goes.
Mm-hmm. Now, just briefly, if anyone in the audience has any questions, you could type them in the chat box, and I'll read them, or Aldo and Jose will respond to them. Now, like going a bit more abstractly, coming into this venture, this business idea, what were the lessons learned, that like the specific lessons on entrepreneurship inside a healthcare space, which you think would be helpful for other healthcare entrepreneurs? Like we know that, again, in the MCA, the Innovation Center, that the healthcare is a very particular, a very specific beast, and when it comes to entrepreneurship. So what insights can you share? What lessons have you learned on being on that specific area?
Yeah, I think a couple things. I think it's really solving a problem, knowing exactly to the granular level who your customer is, and that way your messaging can be really targeted at that one customer or that type of customer. And then talking to, it's, I think for us in the beginning stages, I think it was really I mean, we got started a few years ago, and I think the tech space in general, the startup space in general in El Paso was still very nascent, and I it's better. It's definitely a lot better than what it was when we kind of first started getting into this. But I think the part that I think was rough in the beginning for us was talking. Like we had to get out of El Paso to learn more. I think the MCA was a great start for us, and then just having to continuously refine. So like our pitching got a lot better the more we did it, and I think that's another really take home point is like because we were pitching to everybody. I mean, man, we pitched to everybody, anybody who would listen, and part of it was just going out there and pitching, but the other part was getting some really constructive feedback on exactly what we were doing wrong, and I think that didn't occur until we did more reps of pitching, and then people could really see, like, oh, your go-to-market strategy or your value proposition, or all these things could be cleaned up a lot more. And so then that, because it's a different, because I talk all the time, and when you're presenting patients to whoever, that's a certain type of presentation, but the pitching part is very unique, and so you got to hit those points really clearly. And then who you're pitching to becomes really important also. So just because people have money, because if you're fundraising, it doesn't mean they're the right people. And so you just like having a CTO or somebody who has technical expertise doesn't necessarily mean that they're the right person. So there has to be a fit, whether they got to bring something to the table too. It's not just money, because it also helps inform you as a company how to move forward, or maybe what you're doing wrong. Because I think people develop blind spots, and I think that you end up having this kind of bias, this confirmation bias, like, oh yeah, I'm awesome, I'm doing these things. And then, if you're just pitching to your abuelitos or whatever, they're going to be like, oh yeah, mijo, you're so good at this. But you got to pitch to people and pick people who are going to be really critical of what you're doing and have important feedback for you to grow. So a lot of stuff I just kind of threw out there.
On that last point that Aldo was talking about, if you're pitching to a fundraiser who's interested in fashion, that it's going to be a painful pitch, because you're going to have to explain at depth what you're doing and say, well, what's that business like, or why is that a problem? And so going to people who understand the healthcare field, who understand the hospital field, understand the pain points of doctors. In our case, it was really important, because we did pitch to a lot of people, and there was and the pitch took too long. I said, you need to get this down to 5 minutes. And he's like, well, I'm spending 20 minutes explaining the industry and so how to explain the solution to the problem. And so that became a big thing. The second thing that's important about that is when you do pitch to the people that would understand your field, when they turn around and look at their network, they're people that are going to benefit you. And so you go to somebody who understands the problem. I get it, and wow, I'm going to connect you to X, Y, and Z, because I'm invested with them already too, and it just grows a lot faster. But doing the homework to see who you're going to pitch to, I think is really important, right? Especially if you want to have some good outcomes. And also, Aldo also talked about just being razor focused on solving a specific problem, starting small. I feel like we had identified many problems, and we thought we can hit them all and say, oh, we're going to solve them all with the solution. And start putting due diligence into each one of them, and they all needed their own time. I only have one kid, but I imagine it's like having 10 kids. They all need their own love, they all need their own time. And so, it doesn't mean that after you're not successful in one thing, that you can't do the other ones. But being razor focused is extremely important. So the same 2 points that Aldo talked about is good. And then, also, a new one in there is having your co-founding team, making sure that you guys are on the same page and that you get along and that there's a like-mindedness there, because you're going to spend so much time together, and it's like a marriage. So you have to make sure that everybody gets along and has the same vision.
On that note, how is it that you keep yourself working, collaborating? You're not in the same city, right?
We're not. No,
We're not.
Joey's in Austin, JP's in the Bay Area, and I'm in El Paso.
Yeah. So how do you work together as a co-founding team, building a business, and especially remotely?
Yeah, I think setting the vision becomes really important, and then checking in. I try to check in either independently with a team every day, to make sure we're moving the ball forward. And then ideally we're all meeting together every day. That would be the best case scenario. And then we fly out. So we meet like at least on a quarterly basis. Things are different with COVID, but the goal was for us to kind of meet quarterly in person, and touch base that way.
But we have technology meetings every Saturday. We review the app every Thursday afternoon. And so we're constantly communicating in one way or another. And that's been it. Prior to COVID, I was in El Paso twice a month. The geographic areas that we're in has also helped us open different networks. Second round of funding came from Austin. JP was part of Latino Business Action Network, which we were accepted into and completed recently. And so we're able to open our network by also being in these geographic areas. So I think we've had kind of the best of both worlds, but it's upon us to make sure that we continue to communicate constantly.
I want to talk a little bit about the last things that Joey with the Latino Business Action Network. So it's a Stanford program. It's called LBAN for short, Latino Business Action Network. So it's a company, it's a program for Latino-led businesses who have raised at least 500,000 or making $1 million in revenue, and it's a scaling program essentially. So it's weekly meetings to help teach the focus of scaling and the pitfalls and all the other things. But I think one thing that really helps for us is that it expands our social capital. I think those things become really important because the Austin connection became really important for us because Joey was there locally and he was kind of spreading that. I think it's a little bit tough, and I'm not trying to be like the Debbie Downer here with being a passive, but just we have to know what's real. And there's a group of investors here in El Paso, and I think they're involved. And then I think you have this group, and I think MCA kind of does a great job of putting you in contact with that group. But then there's also outside, because they might not be in the space that you're in, or they show the same interest that you have, and so then you gotta get out of that network, or expand at least to these other angel networks. And so that was I think having the guys in those different geographical locations really helped us improve, especially like JP. We got some tech talent from the Bay Area, and that definitely helped us. We'll always have an eye for local talent too, and so our goal is to kind of be mentors as much as possible, and not necessarily to be mentors, but also just to bounce ideas and be peers, and we just talk about our problems, because even though we might be in a different solving different problems, it becomes really important, I think, to look at solutions on how you achieved pitching or fundraising or legal questions, etc. And I think that building the community in El Paso from that startup community is really important. And and I think you guys do a great job of, I mean, this is what this whole thing's about, right?
Yeah.
Yeah, exactly. And as you said, it's great. It's actually kind of an advantage that you are in those cities, because the talent and programs from the Bay Area are huge. Austin is up and coming. There's a lot of entrepreneurship, venture capital there. So, and El Paso has the great Latino market that it's a great starting point. If anything comes out successful from El Paso, that's like a great launching pad for the rest of the country. So that's great. Now, you mentioned financing that you've gathered, that you've focused on this year. How was the process? What did you manage to raise, specifically on the healthcare space? Like, how was that, like a conversion? Talking to venture capitalists, explaining the industry, as you said. How was that process? Could you tell us more?
Yeah, I'm gonna, Joey will have you, because he's our CFO. He headed up that process. But I just want to point out that I put my cell phone number on the chat, and I also put my email. So to anybody who wants to get in contact, my information's there for everybody.
Yeah, so for us, initially, we had been in contact with a local El Paso group for several months, and the conversation was there. And again, when we talked about reaching out to like-minded people, we were reaching out to people who care about the community in El Paso and wanted something better for the community. And that's where their importance came into what we were doing. Like a lot of fundraising into process, we didn't go to venture capitalists. That's kind of like our next step in the process. We were at the seed and angel fund levels. And, some of the first early believers in our product, it was the MCA. We received money through the MCA, through competitions that we were in. And then also through the Innovator program, and that went a long way. Again, we got funded by a local group in El Paso who also believed in us and gave us confidence to see that it wasn't just our vision, but that we could talk about our vision and somebody say, oh, wow, that's really neat. I think that's something that we need. And took us to our third area for us to get money is outside of Austin, where somebody said, man, I see that need not only in El Paso, but in San Antonio, in the Valley, in Houston, and Dallas, and through our pitching, they were like, yeah. And I'll say this, that our second round of funding, the time cycle was shorter, and all talked about the number of times we were pitching. Well, we got better at explaining who we were and what we were going to do, And as we're generating revenue, as we're bringing on users, hopefully our venture capital round will be that much shorter. Because now we're proving our idea and are becoming a lot more attractive to these VCs. But without doubt, if we're gonna be national. And I don't think international is our plan yet. If we're going to get into those other demographics, geographic areas, we will need VC money. There's, it's something that when you try and compete with the best, you just need those dollars.
Great. So we're coming up on the hour. Just one of my final questions that I wanted to ask you is, being this intimate into the telehealth, telemedicine market, what trends are you seeing now that we're transitioning out of COVID, that we're in this kind of hybrid models right now? What trends are you seeing? What does the future wait on telemedicine? And like, yeah, what do you see moving forward?
So telemedicine, I think it's it's not going to go away, and I think the important part is because the billing is there for telemedicine, so government's paying for it. But it's not for everybody. I think it's going to be part of healthcare. So maybe about 5% of patients, maybe 10% of doctor visits will be telemedicine, and then it'll probably stay there. I don't think we're going to see another pandemic like this, right, for another probably 100 years or something like that. Well, who knows? But this is where I think that communication will stay. What's the next big push is really quality. And right now, if I have a bunch of sick kids, so I'm a pediatric gastroenterologist, if I have a bunch of sick kids in the hospital, it's great for me because I get more business, right? The sicker they are, the better. I'm going to take care of them and I bill, and that's called fee for service. But the push is really in quality and how the government's going to reimburse you or a physician or a healthcare system for being an awesome healthcare system. And so it doesn't necessarily matter how many patients you're seeing in a day. What matters is how good you are at taking care of them. And it's tough for one physician to take care of 10,000 patients. You need a team. And so one of my mottos is like bad team, bad doctor, right? Because everybody just kind of blames it on the doctor. But if you've got an awesome team, you're going to look like a star. And so that's called quality improvement or quality care. So that's going to be, I think, the driver for technology. And you're seeing it a little bit in chronic disease management, where like there's like blood pressure cuff monitoring and asthma care or chronic obstructive pulmonary disease care. And so, that's the quality space is the I think is the future of all medicine, because it puts caps on the amount of money spent. And so what can you do as a technology to kind of help improve quality so that way you can meet those caps?
Great. Jose, or even JP, do you have anything to add?
Yeah, it's not going away. This was something that was bound to happen, within the next decade, but it got in the fast track because of COVID. Yeah, and I think a lot of people have want to consume their medicine in this way, especially as you talk about millennials or centennials moving forward. But on the forefront, the quality has to be there, because you'll have a lot of players that will be providing medical advice, but with no follow-up. And so the conversation has to be based on quality, not just access. Because they're telling you information, different doctors have different information for you. But if there's no central person managing your healthcare, which is why we talk that we are a patient management software, that's where the key is. There has to be management and quality.
Great.
And one of the last things I would say, Alberto, is that I think that, there's a lot of this whole variety of people in this business that it's super important to always like hold your values very close to, or adhere to your values as much as you can. Like, you have no idea how many like random people we've run into that are just total like trying to take you for a ride or trying to do like shady stuff. Always surround yourself with good advisors. I think that's really important. And then like, don't stop believing, dude. Like, como dice la canción, right? Like the song says, you gotta keep believing in what you're working on and what you want to build, and let that sort of guide you throughout your through this journey. So
I was hoping for a Chente work reference.
Right. Thanks, Alberto. Thanks for setting this up.
Oh, thank you all for joining, Jose, Aldo, JP. It was great having you here. Very great hearing your insights into the healthcare entrepreneurship landscape and all that. This has been the last Tech Tuesday of the year, you're here like our closing speakers.
Awesome.
Yes, sir.
So
Muchas
thank you very
gracias, Alberto.
much. Thank you all. I see Nancy is on, I think. Yeah.
Yes, I'm here. I'm just typing a note to you all. Congratulations. It was wonderful insights, great lessons learned. And I would say, thank you for letting us work with you. We're really proud of your success.
Thank you.
Thank you for keeping up with us, Nancy. I really appreciate that that you do. And if you need anything from us, please reach out to me, Aldo, or JP.
We will do. Okay.
Definitely. And thank you everyone who joined into the event. And hopefully we'll see you next year with a whole new calendar of events and workshops that we're working on from the Innovation Center, the MCA. So next year there comes a lot of things, good things for the entrepreneurship scene on El Paso. So thank you very much, everyone.
Awesome. Thank you very much. Thanks
Great.
for
Happy
setting
holidays,
us up, and
guys.
thanks for the opportunity.
Thanks,
Bye,
guys. Bye-bye.
gentlemen.